Are you confused by the various healthcare systems in your country and around the world? You're not alone. This is the Anatomy of Healthcare. Dr. Jabal, MedSchoolInsiders.com. Perhaps you think healthcare is broken and like many of us, you want change. But we must first understand healthcare before trying to fix it. In this 3-part series, we'll explore the major healthcare models of the world, how the US fares in comparison, and what changes to make. Moving forward. The blueprint of healthcare. Anytime you think about healthcare, whether abroad or here in the US, this is the blueprint that should come to your mind. At the root level, healthcare systems come down to 4 constituents: the government, the insurers, the patients, and the providers, which includes doctors, healthcare professionals, and hospitals. Depending on the healthcare system in consideration, the interaction and dynamic between these constituents vary. For example, sometimes the government is the insurer, which means that it takes on the financial responsibility. Other times, the government is completely out of the picture, or it may play a regulatory role. The 4 factors behind the global healthcare models. There are 4 factors to consider between the 4 major healthcare models. The first factor is the number of sources of coverage, or financial support, that exist under the model. If there is one source of coverage, we call it a single-payer model, and if there are several sources of coverage, we call it a multi-payer model. The second factor is the source of coverage itself. This could be the government in single-payer models or private insurance companies in multi-payer models. The third factor is the source of funding. How are the government and insurance companies getting money to provide coverage? The last factor in consideration is the sector responsible for delivering care, the private sector or the public sector. This has to do with whether the hospitals are government-owned or privately owned, and whether the doctors are government-employed or privately employed. This has major implications for the government's regulatory power, autonomy of providers, and innovation. Each of the 4 major healthcare models sits on different points of the nationalization-privatization spectrum, with one end representing 100% nationalization in which the government fully funds and delivers care, and the other end representing 100% privatization in which the private sector fully funds and delivers care with no input from the government. Broadly speaking, nationalization is associated with greater accessibility to care, lower costs, and reduced administrative complexity, whereas privatization is associated with less regulation, greater freedom for physicians, and a more fertile ground for innovation.